Hello and welcome to the latest podcast from the Staffordshire and Stoke-on-Trent Clinical Commissioning Groups. In this week's episode, we're talking about the safeguarding of children. The police, NHS and local authorities are required by law to make arrangements to work together to safeguard and promote the welfare of children. But with schools and other youth group activities currently working differently, or in some cases not at all because of the coronavirus pandemic, there are concerns that signs that a child may be being harmed could be missed. It's thought of as the hidden harm. Stephanie Nightingale is one of two designated nurses for safeguarding children within the CCGs. She's been talking to Richard Caddy about the importance of looking after children as a partnership of organisations.
They're important because we need to understand what life is like for children, and in order to do that, we need to work with all the other agencies that are involved in children's lives. We are key partners with the police and local authority, and we have legislation that places us in that position. Ultimately, our aim is to protect children and to promote their welfare. We can't do it in isolation, and so we are accountable for each other's actions, really, and just to ensure that children are safe.
I mean, in the past, there has been quite some criticism that different organisations don't work together. GPs, social care, the police, hospitals don't work together, and opportunities are missed to recognise that children are being harmed. Is that changing now?
Yes, I think over the years there's been a drastic move towards safer care of children and also the early identification when things go wrong. We have something in Staffordshire and Stoke-on-Trent called Early Help, which enables us to identify children in need or at risk of harm at the very earliest stage, which actually supports any future work going forward, and also highlights the need for children to perhaps be placed in a safer environment outside of their parental home. The idea there is really to for us to seek assurance that our providers, all our practitioners out there understand what safeguarding means, and to put things in place to ensure that they are safe, and if there are things going wrong, that those things are identified early on.
Obviously, we're living in very abnormal times at the moment with the coronavirus crisis. Can you explain to us some of the ways in which this is changing how you work?
Yes, well, I mean, we do have assurance currently. One of the things we've been working through are our weekly risk assessments of this current situation. And we know that our provider services have frameworks in place to work around some of these challenges, really. But we are assured that children are being seen, and there is an awful lot of work going into making contacts virtually, as we're all having to do now.
What's happened to referrals during the COVID crisis? Have they gone up or down?
So child protection referrals have quite significantly reduced over the COVID period. We are aware that children who have been made subject to a child protection plan during that period has actually significantly increased. So we know that leading up to lockdown, those children that had already been identified as children of concern have proceeded to a child protection plan. And what that means is that they were deemed to be at risk of significant harm, and they were required to have a safe package of care wrapped around them with other agencies' input. So I think the fact that there aren't referrals, the number of referrals going in as there normally would be, suggests the lack of face-to-face contact with children, which you would expect aren't accessing education, and when they're perhaps not having the routine contacts they would normally have with the health visitors, GPs, midwives, and also the local authority support staff.
You mentioned education there. Are schools an important way of raising concerns about safeguarding issues?
Definitely, and we know that our number of referrals predominantly fall on our teaching staff and teaching assistants, and so with children not being in school, they're not being identified early in terms of having need of support or if they're at risk of harm. So there is, I understand, there is processes going on around that in terms of monitoring children at home a little bit more closely, those that have already been identified as vulnerable.
So are your concerns that people's behaviour might be changing during coronavirus and that more children might be at harm because of it?
Certainly, we are aware that domestic abuse, parental mental ill health and substance abuse is a cause for concern with regard to the care of children. We obviously knew that pre-COVID. What we do know is that the number of incidents reported to the police and children's social care have actually fallen with regards to domestic abuse incidents. However, the numbers of inquiries have increased quite significantly to our domestic abuse specialist services. So we suspect that domestic abuse will be probably one of the most significant factors in children's lives that will be causing some problems at the moment. And that's obviously in light of the lockdown stresses and potential financial constraints that our families are under at the moment.
Yeah.
But also
everybody's worried about money, about relatives,
absolutely, and they haven't got their support network around them anymore. So the emphasis to socially distance is obviously incredibly important during this period of time. However, we do recognise that a lot of our families are so very reliant on extended members of the family to provide them with that support, and also education. You know, young parents quite often rely on their parents to help support them with, you know, how to actually learn to look after a young child. So there's a lot of repercussions, I think, as a result of the decisions that have been made. I suspect that parental mental ill health will also be an effect of that, and also those families that those children that are exposed to substance misuse, alcohol misuse, things like that. There's bound to be a knock-on effect as a result of the lockdown.
Are there any additional ways being made available for people to raise any concerns at the moment?
Yes, certainly if anybody is concerned about a child, we would advise them to follow the normal processes written in our safeguarding policies, which is to make their referral to either Staffordshire or Stoke-on-Trent Children's Social Care, as they would normally pre-COVID. The police, obviously, in terms of any urgent concern about a child, to contact the police. If there is any health concern about a child, to contact NHS 111. And with regards to domestic abuse services, we have a list of the specialist support service contact details on the CCG website that anybody can access if they require that additional support. Obviously, when this sort of period of lockdown started, there's been an awful lot of work that the CCG have implemented around testing for COVID. So the testing sites have been a really good opportunity to share that message with regards to domestic abuse support. So the testing centre sites have the domestic abuse posters made available for anybody who's driving up to be tested, and that will signpost them to the local domestic abuse support service with a contact number and website address. And it's also an opportunity for anybody, if they're on their own and they feel safe to do so, to disclose any concerns they may have, either about themselves or about somebody else they may be concerned about. Again, another opportunity to be able to hopefully intervene early and provide some support and safety for those individuals concerned.
And I understand pharmacies are playing a role in this as well. Could you just explain that?
Yes. So in terms of some of the innovative work that's going on at the moment, we are working very closely with our police and local authority colleagues to set up what's called safe places within pharmacies and supermarkets across the county and the city, which again will provide another opportunity for anybody to access if they've got a concern, either for themselves or for somebody else who may feel that they're not safe at home.
And how will you recognise one of those safe places?
The areas will be advertised within the next few days, I believe, and we haven't got a list as such yet, but it will be something that will be distributed widely once we have the details of those particular safe places that are available.
A lot of people will be aware that their own anxiety levels have increased, and that might be affecting their behaviour. Maybe they're drinking more than they perhaps normally would. Maybe they're more short-tempered. Maybe they're acting more aggressively and they're worried about their own behaviour. If you recognise that in yourself, what can you do?
I think it's, if you can identify when things are going wrong for yourself, it's the first start of a recovery journey for anybody, isn't it? And I think anybody who's feeling like this, they have the options to talk to a few people, really. They can, if they feel that particularly their mental health has been affected throughout this period of time, we would always advise seeking some advice and support from their GP. GPs are available. They may provide a virtual or telephone service. However, if they feel they need to see you face to face, they will do. So that is available currently. There is also NHS 111 if you feel you also need some health advice around perhaps alcohol misuse. If you feel that, you know, during this period of time you are drinking a little bit more than you would normally and you just want to get some advice on that, NHS 111 is also a very good place to start. There are also very specific services which you can access online with regards to alcohol and substance recovery. So you'll be able to do exactly the same through those sources as well.
We know there are going to be restrictions in place for quite a considerable amount of time. What do you think is going to happen? What are going to be the changes in safeguarding as we get into the recovery phase, do you think?
We are aware that, and we are starting to make plans around this in terms of the hidden harm that children are currently experiencing during this period of time. And we anticipate that post-lockdown, when children are more visible, we are likely to see a surge in referrals and more causes of concern. So I would ask, obviously, that everybody sort of remains vigilant with regards to that. We are going to see quite a significant increase, I believe, and we need to prepare for that.
Finally, what we really want to let people know is what they can do if they've got concerns about children that they're aware of.
If you have a concern about a child, you can contact your local children's social care department, which is, the information is available online. If you go to the local authority, which is Staffordshire First Response, and also if you feel that you have an urgent concern, so immediate cause for concern for a child, please contact 999.
Thanks a lot for that, Stephanie. It's been wonderful talking to you, and thank you for all the work you've been doing.
Thank you.